We are live on Planetary Health First, Mars Next, and I'm super excited. We have Alex Whitefield, and not only is he a superhero, but he's a nurse. So really, all nurses are superheroes, and he's a founder of a startup, Breakalgo, and I could figure that out. Sometimes I have difficulty pronouncing things, but it makes sense. He's going to get more into that. But he's been in the field for a while, many years working as a nurse at different settings. But do you want to share a little bit about your background, Alex, just to give our audience a little more about that?
Yeah, absolutely. I started my career, graduated from Washington State University with my bachelor's in nursing, jumped right into a local community emergency department in Tacoma, Washington. Worked at, it was a level 4 trauma center, just like I said, a community hospital, underserved population. Worked there for 2 years, jumped over to a level 2 trauma center in Tacoma. Worked there for another almost 2 years, and then moved over into worked at Madigan Army Medical Center here in Washington as well as an emergency room nurse. So that was my bedside experience, but mostly all emergency time, and really enjoyed obviously working with the patients and helping the community and the everyone that I was able to have the pleasure of caring for. So. And then transitioned over into a leadership role at Mary Bridge Emergency Department here in Tacoma as well. Really enjoyed that time. Big transition from adult mixed ERs to a pediatric specific one. And then pivoted that role into outpatient setting. I spent a little bit over a year with Seattle Children's running their ambulatory clinic or outpatient clinic. And now I'm with Kaiser Permanente. All just phenomenal journey. It's you look back at your career and you think about all the people you helped, all the people you've mentored and trained along the way. So it's been a really rewarding career. But obviously it's healthcare, so it's come with some challenges as well.
And that's sort of why we're here. You are the founder of Breakalgo, and it's all about trying to empower better care. And there's no care that if your patients aren't taken care of by nurses or staff that are taken care of, right? If you don't have your breaks, if you don't have your time. So that's really love to hear how you started. But before we deep dive, I want everyone to know that Alex will be at Vive. You'll be at Vive, right? And you're going to be there, Breakalgo. And tell me a little bit about that, because that's really super exciting. And congratulations for that opportunity to be there.
Thank you so much. We're going to be with Nurse Approved, Rebecca Love, and then several other founders in a nursing innovation pavilion at Vive. We're at booth 636. Just tremendously excited to bring our program, our platform there, introduce it to a wider audience, and hopefully get it off the ground. But just the opportunity, if you look at the speakers, you look at the presenters, Vive has just tremendous opportunities to really showcase what the future of healthcare technology and healthcare in general is going to look like. And just a true honor to be there amongst some real heavy hitters. And I'm hoping that we're able to get, like I said, our platform off the ground and more visibility to it, because we need to solve for breaks. We got to solve for work conditions that are driving so many nurses, so many healthcare staff out of the front lines.
So if you could call out a message while you're out there, who are the types of people you'd like to meet? What are you hoping? If you could send out a signal, we'll do this live on Friday, and hopefully, what would that signal be, and who would that be to?
I would love to engage with anybody who manages frontline staff, anybody who has any sort of connection towards operations. We're looking for people to partner with. We're looking for future customers as far as our product as well. So managers, CNOs, CFOs, our story, our product transcends really all of those aspects where, we have frontline leaders that's impacted by breaks. We have financial aspects that are hit by breaks, HR, even providers. We think about providers, breaks impact providers as well, because when you have burnt out nurses, when you don't have nurses, our providers' ability to care for their patients suffers as well. So anybody who's concerned about improving the work conditions of all healthcare staff and outcomes, I'd love to talk to them and see how we can engage and move this movement forward.
And I would imagine right now what you're wanting to do is really work on some really early, really solid clinical studies, efficacy,
Yep.
ROI, some pilot customers that really could be those early adopters that get it, that really want to partner with you.
Yeah.
And so I think that's, in startup struggle and everything, that's the hardest thing, is getting that first. And you have a technical engineer. Everyone should know that you're the nurse, you're the SME, you're the
Yes.
SME. You're not behind the scenes developing this, but you have a
No.
developed product. You have a technical person. You want to share about that?
Yeah. So I have two partners. They're both software engineers. I had this idea years ago, and I Googled how to program, and I think my computer started laughing at me. Legitimately, it was like I was like, how to write a program. And I think Google responded with like a chuckle underneath its breath. But I was lucky enough, a good friend of mine is a very successful engineer, and he brought on another partner, and we've been working for the last 4 years to refine our product to make something that is, we want to take the load off. In so many programs, so many platforms that I've seen as a nurse and as well as a leader are burdensome. I don't need 7 more clicks. I need 1.
Yeah.
We've really tried to model that Apple philosophy where less is more. And so we want to take the burden off, but also not add by, clumsy software.
Well, Alex, I really feel privileged that you and I had a good conversation earlier. I think it was last week last week. And I was like, man, we have to get you in the studio before Vive. And this is a huge problem. I mean, anyone that's in healthcare needs to care about this, because it's the front line, that 12 hours of work. And these typically were on whiteboards, like the scheduling,
Yes.
or on note boards. They're not happening. Or if,
Yeah.
so it's compliance is an issue, but really patient safety, and then retention. So it
Yeah.
seems like, I would imagine soon you'll be able to have some really powerful ROI with, just staff retention alone,
Because I think the state of nursing, I think that really kind of underpins all of this. If you look at breaks across the nation, there's about 17 states that have laws on the books that support breaks. Probably 3, maybe 4 of those states have robust laws that dictate. So, for example, I'm in Washington, Oregon, California, all have pretty rigid laws as far as breaks, the consistency of them, the windows which they need to occur. That's been our primary kind of effort to solve that. But if you look at across the nation, you look at Reddit boards on nursing, breaks that get hit again and again and again. It's a pun of jokes. What is a break? That whole thing. And so what we have right now, kind of like I said, in the state of nursing, is we have a tremendous number of frontline clinical staff working 8, 10, 12 hours, not easy work. And they're doing that really with very few, if any, breaks. And it's just not sustainable. I was lucky enough to connect with the researcher, and she was sharing with me some information on cognitive load and cognitive ability. In the span of 4 hours, and again, I don't have the study on my hands here, but in the span of 4 hours, your cognitive ability starts to decline. And so if we think about working 12 hours caring for a patient without a good opportunity to unwind, that kind of continuous decline that we see in people's mentation, and that is going to result in compromises to the patient's care, compromise to their experience. And then the other part of that is the is the challenge and burden that the nurse carries with them as well.
Mhm.
You know, working all those hours, you run into something difficult. You don't have time to unload or mentally process that. You're on to the next patient, on to the next task, on to the next admission. And so we have to establish nationwide a standard of receiving regular breaks, including meal breaks. It needs to have a systematic approach. Like I said, my goal is to drive breaks across the nation. I
Mhm.
don't think that an ICU nurse in Alabama should get any less breaks than an ICU nurse in California or vice
Mhm.
versa.
Mhm.
But the whole goal here is to give those nurses the opportunity to unwind, to take a break,
Mhm.
care for themselves, then move further, obviously
Mhm.
unpack some of those mental things, decompress. If you do
Mhm.
that through the day, I believe we'll see better retention and less burnout as a result of it as well.
And when we were talking last week, you shared about the 2 years, like the lifespan of nurses. So it seems like, man, if you can have some tactics in place to retain the future longevity of the workforce,
Yeah.
this would be one of them. So get into that a little bit. I had
Yeah.
no idea that. I just can't even believe that. I need to see the data on that.
It's shocking, really. I kind of tell this story. My brother is in the construction industry, and we were talking about the different trades, and he was sharing with me that the sheetrock slash rebar people burn out so quickly. And I remember sitting there talking to him. I was like, man, I think he cited, 5 or 7 years. He's like, after that, their bodies start taking a toll. And I was like, man, that's really, really unfortunate to think about a tradesperson after 5 or 7 years burning out and, more or less having to pivot their career. And then I kind of had that, self-realization that, the nursing career is even worse. I just saw a stat by the ANA. I think it's 18 or 19% don't make it out of the first year. And so
Mm.
1 out of 5 do not, pass their first, they don't even pass go once, 1 year after spending, 3, 4 years working on their nursing degree. They don't even make it into year 2. And then you look at how many folks are looking to get out of nursing. That number's even worse. So we have to work on the work conditions that are driving people out of healthcare. We have, it's a two-legged problem. It's like a trauma patient. Yeah, we got to get more staff in. We have a lot of older nurses that are retiring, but we're also hemorrhaging a tremendous amount of nurses at the same
Mhm.
time. And yes, we got to solve for the supply, but we also have to solve for the loss.
Mhm.
And so breaks are a great way to start solving for loss. We got to make sure that work conditions are good. To me, number one is we got to work on violence in the workplace or
Mhm.
incivility. Nothing demoralizes a nurse or healthcare staff worse than being attacked.
Mhm.
I'm an ER nurse. I can tell you firsthand the impact of the individual and obviously the team when there is a violent situation on the unit. It's horrific.
Mhm.
The second one is we got to look at those work conditions. We got to look at how we care for ourselves, and that includes regular breaks, being able to take a lunch,
Mhm.
getting opportunities when you have a stressful situation to take that moment off, decompress,
Mhm.
put that where it needs to be and continue on.
Yeah.
But 12 and a half
I,
hours and then being able to eat all that other things on your drive home really does add to the
You
lack
know,
of
I'm
sustainability.
hoping that you can get a study going, like at NIH or some like really cool, I don't know, big organizations. I mean, before and after, or like you can have
Yeah.
a big group that's receiving a treatment, maybe it be Calm app or some sort of whatever for 15 minutes with your break algo solution. I mean, to
Yeah.
me, that would be such a awesome opportunity for well-being, worker
Yeah.
well-being. Like, first off, how can you have that if you don't have a break? And then with that, so maybe there could be a cool partnership that evolves. Just hey, this is something here.
Yeah, absolutely. Would love to partner. I've spoken to a couple academics. Would love to see that and really try to deep dive into what are some of those impacts that we can, what are some of those levers that we can use to, again, we can't be hemorrhaging this many out and expect to get ahead. And so I would challenge academics to jump on board and let's see what we can do as far as studying this in a scientific way. And we are, scientifically driven. And so let's do it. Let's take a look at what kind of interventions. And I do think breaks are going to sit as a paramount one. As a manager, I can tell you, I every year we get our employee engagement survey information. And breaks were always on the topic. I've talked to other leaders across the nation, same situation. So
what is the resistance right now?
It's the complication. Well, it's two things. So really we have several states in the West that have good processes, I shouldn't say good processes. They have good rules and state laws that support breaks. But I think it's two parts for those states. It's the need of labor, and then the sheer effort. Actually, I should say three. Three things. It is the labor associated with it. It's the difficulty organizing it, and it's our culture. Mm-hmm. And so I think number one is it does require additional labor. A true break is when somebody's going to take your patients over. They're going to have 100% dedication towards Michael's patients. You're going to be able to walk off the unit, not have to worry about, is the person that's also covering 5 other patients going to, take a look at my patient if they need something. And so there's additional labor cost, and obviously that's a difficulty there. The second one is organizing these breaks. It is difficult right now. For example, in the West, nurses are entitled to 3 15-minute break, or generally 3 breaks ranging from 10 to 15 minutes, as well as either 1 or 2 lunch periods as well. Each one of those need to happen in unique times, specific windows. When you have that multiplied by different start times, nurses start, especially in the ER, we kind of ramp up and ramp down throughout the day. And so you could have 3 or 4 different shift lengths, and then you could have up to 5, maybe 10 different start times across, 15 to 30 staff members. You start laying that all out. Everybody has 4 breaks. They all need to sit in a special window. It becomes very complex as far as trying to get every break started and stopped, or, at the right time. That's where Breakalgo comes in. That's really what we've solved for. Is we've created a algorithmic tool, a scheduling engine that is able to stack all those breaks together and give you a plan. Because again, that, as somebody who's pushing hard to get all those breaks done, that is a big operational lift as far as taking a systematic approach. Right now, the bulk of folks are using, either a staff sheet, paper and pencil, or a whiteboard if they're sophisticated, to put that whole calculus together and try to come out with something good on the other side. It also results in bias. Obviously there's folks that are going to migrate towards other folks and make sure they have breaks. You have quiet folks that don't get any breaks. And so there's a real equity issue as far as, who's getting those breaks, who's not.
The middle school effect.
What's that?
The middle school effect, right?
The middle school effect, absolutely. And then lastly, we got to change our culture. We have to make breaks a necessity, not a luxury. Some even amongst our peers, amongst nursing peers, there is even judgment when hey, I got to have a break. Oh, you got to have a break, huh? I'm like, yeah. I'm a good ER nurse too. Just because I want a break doesn't make me anything less, or I'm a great med surg. All these. Yeah. Just because you admit that you need to take 5 minutes off or 10 minutes off to go have a cup of coffee, sit down and unwind your thoughts doesn't make you anything less. Or
use the restroom, right? You don't need to be doing catheters at the workforce, right?
Yes. Nobody should be,
So when I'm hearing this, I feel like in the end, we're spending so much unnecessary resources, capital and staffing, retention. We looked during COVID. I mean, all these, they didn't have enough, and then of course, times have changed, but I mean, you would want like 2 to 3 or 4 or whatever, 2 organizations where you can show them the data. I would imagine if the companies, the organizations, hospitals that put your system Breakalgo in place are going to retain them. In the
Yep.
end, they're going to save money, but it's that chicken and egg thing, right? I mean,
Yes. Really, like I said, we're looking for people to partner with, and if there's any organizations out there that would want to partner with us and drive through some of this, it would require obviously an innovative organization as well as an innovative leader, nurse leader to support this. But we can't keep doing the same thing and expecting different results. The other thing I think is, I don't want to say hilarious, but it is a little hilarious. When I see some solutions and it's, a wellness card, which is great. I'm not saying anything bad about the wellness card, but when you don't literally have any time to use said wellness card, it does no good. You can have all the other resources kind of thrown at them for wellness and burnout prevention, but when they literally don't have a moment to spare because they are, pushed so thin and no priorities placed on giving them any time for a break or for a meal, when do you expect that work to be completed? And so it really is going to take a shift for that organization to have that focus.
Well, Alex, I hope you find the right culture, the right organization, the C-suite that's willing to say, this matters, and we're going to put our money where our mouth is and really do the right thing, because it seems like a no-brainer, but it's all about money. I hate to say it. I could only imagine if you're doing that many algorithms or algos with the 15-minute breaks, it might be a huge investment in the beginning. But if you don't value retention, if you don't value those sort of things, I mean, the amount of stuff that, if we're building hospitals, we're investing in all this other stuff. So it just seems like it's really about like, I mean, it isn't like what you're proposing. It's not rocket science. And so
No.
I just hope you hear the right person, the right organization, the right leadership hears you and says, let's try it.
Yeah. Yeah. You can take this from, 7 different directions. I think number one is just operationally, our program is going to help, everything you got to have a systematic approach towards it. We all have our own lenses that we bring to it. Nursing has a lens, a philosophy, a way that we approach issues. But you got to have a systematic approach. And that's what Breakalgo brings to the table, where we give you a tool in order to facilitate, right? And if you look at the benefit of that, number one, it does start with compliance. So we have states, we have union contracts that call for breaks. And however those do occur, we're seeing, millions of dollars, multi-million dollar lawsuits being settled left and right. We had one with one of my prior employers. They settled. I ended up walking away, I think $1,500 for missed breaks that the class action lawsuit yielded. So we're seeing civil penalties for missed breaks. Those are still going on. Look up class action lawsuit breaks. You will find a bunch of those moving on. So we have a big one there. Again, like you said, we got to have retention. We're spending $100,000 to recruit and train new nurses. That's an older number, but I don't think it's that far off, especially when you look at these bonuses that the nurses are getting. So we're spending a tremendous amount of money recruiting new nurses. We need to figure out how to create the work conditions that's going to keep them in the field and not burn them out after 2 years and have to spend another $100,000. And then thirdly, it's the operational cost, where we do need to have a systematic approach towards breaks. If the organization is going to, be at the cusp of what should be happening, we have to have a good approach and not waste any time and be judicious with those resources.
So what would the start look like with a discussion with like your ideal, if I imagine a pilot, what would be your dream ask?
My dream ask would be an organization that's dedicated towards their staff. An organization that's innovative, wanting to, I think It'll be a great marketing tool down the line for organizations as well, where they're going to be say, hey, we're different than these other ones. I mean, we're all looking for differentiators, right? And hospitals are no different, and they are trying to court nurses in every way they can. And so this is an opportunity to differentiate. And when you go back and say, hey, listen, 98% of breaks last year were successfully completed. Our staff had their engagement were higher. Do you want to work here where everybody is a little happier? Or do you want to work in the place that's going to grind you for 12 and a half hours, give you a big bonus to start, but grind you for the rest of it? So the organization I'm looking for would be someone that is forward facing, someone that is invested in solving for this problem. They have to be innovative, and one that has the tenacity to be first.
And how long would you think you would need? Like, how many weeks? Would 6 weeks be enough to show some real data? What do you think would be just like to lower that barrier? Like, I don't know.
I think a couple months. I don't think it would take long. Again, our program is ready to go. And we just need to get it in the hands of some different folks to test it out. And so, yeah, we're looking for anybody that would be willing to take it on and give it a shot. Because again, paper and pencil's not working. It's just not. It's not going to drive the results that you need.
Well, we're excited you stopped by here today on Planetary Health First, Mars Next, and I'm excited. I hope to meet you in person. I'll be at Vive as well, so we'll be broadcasting live at Vive and be running around seeing amazing people. I guess you'll be on stage, right?
I'm not exactly sure. Not quite. I don't know if I'm ready for being on the stage. My mother always said I have a face for radio, right? No, I'm tremendously excited. Anybody, like I said, that's interested in any of these topics, please stop by.
And what's the booth again?
636.
All right.
And we have some other just tremendous nurse innovators there as well. We're working with, like I said, Nurse Approved with Rebecca Love's project there. And there's just some amazing other co-founders there. I would do them a disservice if I were to tell you more about it, but stop by. There's nurses doing amazing things, solving problems that we know exist in the healthcare setting with solutions that, again, when you live the experience, you know the solution, and these nurses are right there on the cusp of that. So stop by, learn more about what we're doing, learn more about how we can support our nurses in healthcare, because we really are the improving these conditions, proving these issues is the linchpin of improving our healthcare. And we all sit around talking about the problems. Well, we have some solutions, and myself and the other nurse innovators there have some tremendous solutions to help move our community forward.
Well, I really appreciate you taking the charge, getting bit by the entrepreneurial itch and doing that yourself. I mean, you've been 4 years, you said, with your developers building this thing. So don't give up, keep going, and really appreciate, Alex, you coming on. And it's been a great journey today on Planetary Health First, Mars Next. Really appreciate it, fans, audience, and peace be with you until next